Bilirubin is a chemical that may reach high levels in people with pancreatic cancer due to blockage of the common bile duct by the tumor. There are many other non-cancerous causes of an elevated bilirubin level such as hepatitis and gallbladder stones. CA19-9 is a tumor marker. A tumor marker is a substance which is produced by the tumor that may be found at a higher level if the cancer is present. CA19-9 levels are often increased in people with pancreatic cancer, although some patients may have normal CA19-9 levels. CA19-9 levels often become higher if the cancer grows or spreads. So it should not be used as the only test to diagnose pancreatic cancer, because high levels of the tumor marker can also be found in some non-cancerous conditions such as pancreatitis, cirrhosis of liver, and non-cancerous blockage of the common bile duct. A special CT scan method, which is called pancreatic-protocol CT scan, is used in this cancer. This method focuses on taking pictures of the pancreas at specific times after the intravenous injection of the contrast. This is done to find out exactly where the tumor is in relation to nearby organs and blood vessels. The results of this test can help decide if the tumor could be removed with surgery. An MRI may also be advised, which can complement or replace the CT scan. A special type of MRI called MRCP is used for pancreatic cancer. PET scan, also called PET CT scan. This is a special test that identifies tumor spread to the lymph nodes as well as distant organs such as liver or lung. This test uses a radio tracer substance which is called FDG. Tumor lights up as it retains the radio tracer. PET CT scan is done selectively in pancreatic cancer patients. Endoscopic retrograde cholangiopancreatography. The short form is ERCP. It is an endoscopic procedure which is performed by a gastroenterologist, which is used to put a plastic or a metal stent in the biliary system to reduce the jaundice. Samples of the tissue can be taken during this procedure, and it can sometimes help confirm the diagnosis of cancer. The patient is usually lightly sedated during this procedure. Endoscopic ultrasound uses a high frequency ultrasound probe which is pushed inside the stomach and around the pancreas to create high quality images of the pancreas. The procedure is performed by an expert gastroenterologist and patient is kept sedated during the procedure. A biopsy is a test by which a small sample of tissue is examined in the laboratory by a doctor called pathologist. It will confirm or refute the diagnosis of cancer. The sample of tissue is usually obtained by a test called endoscopic ultrasound, which we just discussed. All pancreatic cancer patients do not need to undergo biopsy prior to surgery. The biopsy is planned in patients in whom the diagnosis of cancer is doubtful or in whom the chemotherapy is planned as a treatment option.